So now we had seen about all various types of RBC pathologies. Let's see about vacutainers now. So they have lots of MCQs, direct one-liner questions related to this vacutainers. So it's important. So you see lavender kind of blood tubes, right? So the cap is going to have a lavender color, EDTA. So the anticoagulant present in this is going to be EDTA. So it is all of these anticoagulants are going to mainly chelate the calcium. So okay, so lavender is going to have EDTA, and this can be used in tests like complete blood count, peripheral smear, and also for Wintrob's method of ESR. Then light blue colored cap, if you see, it is going to be having 3.2% trisodium citrate. 3.2% trisodium citrate. It is going to be used for coagulation studies and also in Westergren's method of ESR. But the proportion of the anticoagulant is going to be different in both coagulation studies and ESR. So a red vial you must have seen. So red cap is nothing is there. So it is a plain vial actually. No anticoagulant is going to be there. So any serum study, so serum electrolyte, serum calcium, so all of this is going to be, you'll have to use the red vial. So the yellow cap is going to be having a SPS gel. So SPS gel is also similar to the red cap only. Okay, so it is also used for mainly serum studies. Apart from that, you can also use it for HLA phenotyping and also for dispute in paternity disputes. So there also you can use this yellow gel. Then in gray tube, you are going to have sodium fluoride. So sodium fluoride is going to inhibit glycolysis. So you are going to use this gray tube for measuring the glucose. So glucose estimation is going to be done in this gray tube, which is having sodium fluoride, which is going to inhibit the glycolysis. So the green tube is going to have heparin anticoagulant, and heparin is going to be used in arterial blood gas analysis and also for immunophenotyping in flow cytometry, then osmotic fragility. So all of this can be MCQs, right?